Welcome to COVID-19, a local impact, Ottawa Valley. I'm Trevor Riley, and on today's program, we will be speaking to the OPP here in the county about what is enforced when a non-essential business refuses to close, and a message from Dr. Robert Cushman of the Health Unit. But first, we take a look at the COVID-19 situation here in the county. In the latest update of April 2nd, we had no new reports of confirmed cases and no new deaths. Total tests sit at 384. An increase in negative tests coming in at 216, which is an increase of 55, and we are currently awaiting on 161 tests. And now, here is Tiana Tierney.
yourTV had the opportunity to speak with Inspector Neufeld at the Upper Ottawa Valley OPP detachment. He tells us how his role and the role of officers has changed daily operations throughout the COVID-19 pandemic.
Well, certainly how my role has changed is certainly in regards to the personal protection that I have to make sure that all our officers have access to. This is certainly an unprecedented time for the OPP, let alone the world. Certainly we are taking steps in regards to personal protection equipment that we've never ever done before. Items such as, making sure all our officers have access to hand sanitizer, gloves, eyewear, masks. This is all equipment that we've always had as part of our preparation for pandemic, but never actually had to put in place until now. And certainly this extends to not only the wearing of our personal equipment, which has to be wiped down and cleaned on a daily basis. Our cruisers have to be cleaned. The steps that we've taken within the facility to ensure that phones are cleaned, handrails are cleaned, and let alone how we are training our officers to deal with the public, people exhibiting symptoms. So it's definitely unprecedented times for us.
Inspector Neufeld explains to us specifically how our officers are working safely in the community.
Well, much like this TV interview that we're having right now, respecting social distance, certainly. I have always been a big fan of use common sense. If people are not exhibiting symptoms, and we have a checklist that our communications center and our officers go through with individuals that we come in contact with, either for a call for service or just in greeting, that if we have to deal with someone, there is a checklist where we ask them certain questions, medical questions, travel history, as far as is there anything we should be aware of? Could somebody lie about it? That's always the potential. But I think for the most part, everybody we have dealt with, and I certainly have not heard otherwise, have been very candid and said, no, there's been no travel. No, I'm not exhibiting any symptoms. I'm just basically asking about this, and we proceed from there. But certainly the distancing, I mentioned the personal protective equipment that we have supplied all the officers. And again, common sense prevails, right?
A reminder that the Upper Ottawa Valley OPP detachment is not closed but has restricted access.
For the Upper Ottawa Valley OPP and the OPP in general, public safety always remains our number one priority. The detachment has not closed. We are restricting access, certainly, as far as who is allowed in and out. There has to be, we don't just let anybody in right now, and that's for not only for our protection but for the protection of the public. We are referring to it as restricted access, where we are still bringing people in for interviews. We are still investigating offenses. Calls for service are still, 911 doesn't go away, right? We still respond to calls for service. There are still investigations, criminal investigations ongoing. We still bring people into the detachment. However, it is on a more restricted basis.
Inspector Neufeld reminds us that there is a non-urgent phone number you can call for less urgent matters, and an online reporting tool where you could submit a report from your computer without going to a detachment.
There's not a hotline per se. There's our non-urgent number, which is 888-310-1122. We'll call your non-urgent calls for service, whereas an emergency is always 911. We also have, which is something that is relatively newer for the OPP, is online reporting. So any search engine, and these are for, I don't want to call it a minor call for service, because all calls for service are important, but for less urgent. So I noticed somebody spray painted my fence. I noticed I left my car unlocked last night and somebody went in and stole all the change out of the ashtray. So these are still calls for service that have to be investigated and will be investigated, but they are less urgent. They are calls for service that might not require an officer to attend the scene. That's something that could be done online, and it's online reporting. So any search engine on your computer or laptop is just search OPP online reporting and just follow the prompts, and they'll give you all the information. So that is certainly something we are encouraging. Again, as far as the self-isolation that we are recommending for everybody during this state of emergency, if there is a call for service that can be done online, we'd recommend going that route.
The OPP has some responsibilities in regards to the Emergency Management and Civil Protection Act. Inspector Neufeld explains what the OPP is doing.
Yes, certainly. So in that regard, we certainly have some responsibilities, and this is a relatively new act for our officers that have never really been in this sort of situation. So there have been instances as a result of numerous businesses being directed to close down for public safety issues and health issues. There are certain businesses that have perhaps chosen to ignore the order and not close down, and these are calls for service that the OPP is now investigating. I can say that in the Upper Ottawa Valley area, we've been very socially responsible in that our detachment has not investigated a single allegation under this act of businesses refusing to close. So I'm very proud of our community in that regard. Have there been instances in the province of Ontario that the OPP have had to investigate? The answer is yes, and I can say that certainly if we do in fact get a call for service in that regard, is a charge possible? The answer is yes, but that's certainly not the route we want to go. There's certainly the route of discretion that we would want to go first. The education piece has to be there, explaining to the business owner who may or may not be aware that they can't be open. And certainly as a last resort, it would be looking at charges. So the act exists for us to use that piece of legislation to enforce it. However, that is a last resort. And speaking to my colleagues elsewhere in the province of Ontario that have had to use that, they never had to go past the education piece. The officer went, spoke to the the business owner, and it was shut down immediately. Oh, okay, and shut down, and that was the end of it. But yes, we are investigating those occurrences. But as I mentioned, we have certainly been very socially responsible here in Upper Ottawa Valley, and we have not investigated a single call yet.
Gatherings of more than 5 people is in contravention of the Emergency Management and Civil Protection Act. Inspector Neufeld explains.
That is under the same act, and same thing, we would be going with the discretion. So I'll use the example of we get a call, my neighbor's having a house party and it's in contravention of the act. So certainly that is a call for service that we would have to investigate. We would go there, and certainly if that was the case, we would advise the homeowner that they are in fact in contravention. Again, the discretion, the public education piece, the last point would be the actual laying of a charge under the act. So a little bit different with the self-isolation versus the quarantine. Somebody that's actually been quarantined, we have no authority under that act. That has to be the medical officer, or screening officer or quarantine officer that we would be assisting. That's not an OPP-led scenario. We would be there in support of those medical officers. And it's a very serious instance, especially when we're dealing with people's lives, where if you've been medically ordered to quarantine, then you should stay quarantined. Versus the self-isolation, where we have people coming back from trips or business out of the country where they are told to self-isolate. They may not be displaying any symptoms, which is great. They may develop symptoms later on, and the 14-day isolation, self-isolation, is to ensure that if there are symptoms that develop later on, that we can control it. And certainly know where they went and who they came in contact with.
You are watching COVID-19 Local Impact Ottawa Valley. I'm Tiana Tierney.
Hello, my name is Dr. Rob Cushman. I'm the Medical Officer of Health for the Renfrew County and District Health Unit. I'm back again today to tell you how serious this COVID pandemic is and to encourage you to do as best you can, the utmost you can, to prevent the spread of disease. There has been some criticism that we haven't been telling you where these cases are, in which towns, in which hospitals, in which long-term care homes. I must tell you that there's a law and we need to protect the privacy of those involved. And furthermore, for you to know that your neighbor is COVID positive really means nothing, because you should be doing your best to do what you need to do to prevent the spread. You should be self-monitoring, you should be practicing social distancing, and you, in fact, could be an asymptomatic carrier. You, in fact, could be more dangerous than your neighbor that is a confirmed case. So it's up to every one of us to do what we can do. And again, I stress physical distancing, a shopping only for essentials, coughing into your sleeve, monitoring for symptoms, cleaning and washing your hands and cleaning surface tops. All of these things are extremely important. And as I said earlier, you are the Army, you are the foot soldiers, you are the ones who are going to dampen the curve and are going to let us do our work. So again, the message I leave you with today is you are our most important allies. You are our Army in this war against COVID, and only you can reduce the pressure on hospitals and reduce the toll of illness and death that this could possibly take in our community. I have complete faith in you. Do your part. Encourage your friends and neighbors to do the same. Thank you.